For nursing only, wound healing, the factors affecting and the complications. The granulation tissue you people should recollect. So there are blood vessels, spindle-shaped fibroblasts, and lot of inflammatory cells. Edema means space between the tissue. This is a granulation tissue, recollect. And this also I have covered in the previous class. Please recollect the difference between primary and secondary wound healing. What are the factors affecting wound healing? Always you must think of the subheadings. There are general factors that I have given over here. Older age, delayed healing, poor blood supply, vitamin C deficiency, vitamin K deficiency, dependent edema. So in some areas when there is a lot of pressure, there will be delayed healing. Infection, lesser amount of growth factors, diabetes, patient is on steroids. So these are all general factors affecting wound healing. You must by heart write under general factors. How do you diagnose? The investigations required. So you will have to do 4Ds for this. Make a diagnosis of it, defend your diagnosis by means of microscopy, do a debridement of the wound, and develop a cellular response. The 4Ds you people remember for treatment. Local factors, this is again very important. So look at this picture over here. There has been a tissue that is removed, but there is some foreign body that is left behind. We'll come to it later. So site, face you find faster healing than the leg wounds. Size of the wound, smaller wound, earlier healing. Poor wound hygiene, you find that it will delay. Tensile strength of the sutures. If the suture is too tight, it will lead to hematoma and necrosis. Foreign body, as in this picture, will prevent. Topical agents, sometimes they can act as irritants and foreign bodies. Radiation, edema should not be there, and there should not be any stasis. Oxygenation of the tissue. Some tissues heal faster because of oxygenation. Diabetic foot, there is a definite delayed healing. Pressure sore, you people must be aware when the patient is bedridden for a long time. And mechanical trauma, always the patient is mobile. You ask him to take rest, after some time, you find the healing starts. Look at this one. There is these empty spaces are some kind of crystals that are over there marked with the arrow, and there are lot of foreign body type of giant cells. This will delay the wound healing. It can be suture material. Again, the complications of wound healing. Another question for you. It can be infection, it can be implantation. It develops into a sebaceous cyst or an epidermal cyst. Pigmentation with hemosiderin. Deficient scar. So it is not completely covered. Wound dehiscence. So the suturing is complete. Because of the pressure, the viscera comes out. Here the intestine comes out. That is called dehiscence. And the suture is giving way. Incisional hernia, you people must know. Excessive contraction, I told you, will cause a local necrosis. Sometimes that can be. This is again an example of a wound dehiscence and a large wound. Keloid is a fibrous tissue, and sometimes cancer can develop, such as Marjolin's ulcer, can lead to squamous cell carcinoma. The complications you people should read. Keloid is one. Here you find that there's a large scar tissue which is rubbery and it is claw-like. That is why it is called as keloid. Occurs in burns and in surgery. Also in piercing or tattooing. This is a microscopy. You need not by heart. All these pink ones are collagen bundles which are laid down. There is no normal epithelium that is seen, and there is no adnexae or the normal sebaceous glands, etc. So, wide bands of collagen keloid. Wound contraction, you must be familiar. In some patients, there is a lot of fibrous tissue, he is not able to expand. And at the same time, tuberculous peritonitis, there can be the attachment of the intestine loops to each other, adhesions, as in this case also. So look at this beautiful one. On the face, you find that there is a total healing because young age, not a serious wound, good blood supply, it is not dependent, clean and good nutrition. And these are all the factors again you people can go through. So sometimes you find that there is a lot of granulation tissue growing. This is called proud flesh, just like a cock's head. Thank you.